Hello, how are you? In today's video, I'm going to tell you all about 7 very common problems that affect the feet and are closely related to poor liver function. Our body is all interconnected and, in fact, our feet can sometimes show some problems related to poor liver function. Stay with me until the end because you're going to love this video. First of all, if you're new here, welcome. Subscribe to the channel and turn on the notification bell. There are new videos every day and you won't want to miss them. If you know someone who wants more information about health in general, especially about the liver, share this video. Let's work together, you and I, to expand this chain of good because that's what I want most here with the channel. First, before anything else, I want to tell you that this is not a video for making any kind of diagnosis. To diagnose any kind of problem with your liver, it's very important that you consult your doctor. Many of you ask me what kind of doctor you should see, a gastroenterologist or a hepatologist, to check if there really is any kind of problem. I'm going to tell you now about the most common problems related to your liver not functioning properly and the effects this can have on your body, specifically on your feet. So let's get started. The first problem that we often notice in people who have liver issues, which ends up showing up on their feet, are red and brown spots that sometimes appear on the ankles and heels of these individuals. This is closely related to poorer blood circulation, which in many cases of more advanced liver problems is associated with reduced blood perfusion, meaning the blood has more difficulty reaching the extremities. And especially the extremities of the feet suffer a lot because gravity makes it harder for the blood to return. Our heart pumps the blood, and it needs a good circulatory system for the return circulation to work properly. And in the case of people with liver problems, these spots, these reddish or brownish marks, can often appear. So take a look at your ankle, at your heel, to see if you have any. Another problem that often occurs in people with liver issues is what we call spider veins, which, when you look at them, really do look like a distinctive spider web. And this type of vein, once again, is closely related to poor circulation and problems with the blood capillaries. This can happen, once again, usually around the ankle area, but in some people it can even occur on the leg itself, behind the knee. So that's another sign for you to watch out for. Cracked feet can also be a sign of a liver problem because it is closely related to a deficiency of omega-3. And since the liver produces bile, which helps to dissolve fats and absorb essential fatty acids, people with liver problems have poorer fat absorption. So it could be that, in your case, those cracked feet, especially on the heel, where the skin gets really rough and hardened, may also be related to a liver problem. Some people feel itching on the bottom of the foot, on the sole as we call it, because this is also related to poor circulation. And some people experience pain or inflammation in the foot, difficulty putting their foot on the ground, or walking for long periods. This too may be related to poor liver function. A classic sign that indicates more advanced or serious liver problems is a condition known as edema, which refers to swelling caused by excess fluid trapped in the body's tissues. To check for this symptom, you can gently press your finger against the bony area on the inside of the ankle and observe what happens. If a noticeable pit or indentation forms and a depression remains that takes several seconds to disappear, this may be a sign of edema. If this happens, it's a sign of fluid leakage, which indicates a liver problem. It's one of the signs of liver issues, but it's not always the case. It could be a circulatory problem, so it's worth getting it checked out as well. Many people with liver problems also suffer from very hot feet and a very bad odor, no matter how much they clean their feet or their shoes. Because the liver is the organ responsible for detoxifying our body, and if it's detoxifying your body less efficiently, you'll have a higher concentration of bacteria in your body overall. So the tendency is for you to have bad foot odor and very hot feet. And another very classic sign is fungi. It could be a fungus on your toenail or between your toes, because very often poor liver function is related to what we call a very permeable intestine, which allows many bacteria and fungi to enter, even into our bloodstream. It's a very favorable environment for the proliferation of less beneficial microorganisms. So this is another interesting point to observe. Before I talk about what causes liver problems, I want to remind you that I have a list of videos here on the channel that talk more about the liver, giving various tips on how to improve your liver health. I also have another playlist with recipes that are good for the liver to help you avoid any kind of problem and even to assist if you already have existing issues. Of course, you should always consult your doctor and the nutritionist who follows your case, but it's a great starting point. And I want to remind you that some things can harm your liver. Taking medication without medical guidance can really damage our liver, as can alcoholic beverages and large amounts of high glycemic index carbohydrates. Even excessive protein consumption, which needs to be metabolized by your liver, can cause some kind of problem regarding the proper functioning of your liver. An interesting fact is that many people have liver problems at an early stage and don't feel anything at all. So it's really important for us to pay attention to our bodies, like I just mentioned with those signs in your feet, so we can notice them and see a doctor at least once a year, or every 6 months preferably, or even more frequently if you need to, with a shorter interval. But we should see a doctor regularly and have a trusted physician to order blood tests, usually liver function tests, to check how our liver is doing. If necessary, your doctor can request a full abdominal ultrasound or even a biopsy if they need to investigate any problem they suspect you might have. But to get this diagnosis, you'll need to see a doctor to find out if your liver is really okay. Always remember to take care of yourself. And now, let me know in the comments below if you've ever experienced any of these signs, if you have liver problems, and if you noticed a connection between what I mentioned here and any of these signs you already have. I'd love to see your comment, so leave it down below. Also, take the opportunity to share this video with anyone you know who could benefit from it. Let's work together to expand this chain of goodwill, as that's what I want for this channel. And also, speaking of helping each other, like the video because that helps me a lot, subscribe to the channel and turn on the notification bell. I have lots of tips on fitness, health, nutrition, and many recipes, not just for weight loss, but for your health as well. You're going to love it. See you next time. Bye.